another one today. I'm going to be talking about post-acute withdrawal this time, which if nobody has ever heard of that, that's exactly why I'm having this video. Most people know about detoxing and withdrawing from substances, alcohol being the most well-known one, opiates being secondly, that you hear how difficult it is to withdraw from those substances, and it is. But off of any substance, especially if someone's been using it for a long time, especially daily, there is a thing called post-acute withdrawal, which is also known as PAWS, P-A-W-S. What this means is after the point where somebody's body has detoxed the substance from them, like for example, that they're not going to have a positive drug test for a substance, they go through this period that can last up to a year, unfortunately, where they have mental, emotional, and even physical symptoms continue on. It's like the brain is still trying to heal itself, right, from all of this damage that was done, and it's almost like a rebound effect of not using anymore. So symptoms of post-acute withdrawal are, there's a few, right? Here's the top 6. Inability to think clearly, memory problems, emotional overreactions or emotional numbness, sleep disturbances, physical coordination problems, and stress sensitivity. People talk about having body aches, talk about having headaches, just having more increased pain in general, especially if they were using something that was numbing that pain. And it can feel like, holy crap, I'm withdrawing again. But what can also do is tell the brain, oh crap, I don't feel good, and I know what's gonna make me feel good, especially when I feel exactly like this. I know what substance will make me feel good. And it will spark that little light inside someone's head that says, oh, go get that thing that I know what it's gonna do to me, and it's gonna feel good. So it's, people think after they detox, they're done, they're good, I'm never gonna use again, it's no big deal. That's not true. The effects of post-acute withdrawal are sometimes even more severe than the actual physical detox itself, because they're more long-lasting, it's more confusing for people, and now they have to deal with all the problems that were created through addiction, but also deal with this stuff too. So this is important for people not only possibly going to experience this, but for family members and friends that will be seeing the person in day-to-day life, even maybe living with that person, to know it's going to be rough for a little while. They are still sick, and it's going to be like they're sick, and things are going to be harder for them. So people have very high expectations, of course, for people. They've been waiting a lot of times for that person to get healthy for years and years and years. So they have high expectations. They want all these things done. That's not necessarily going to happen right away. And to expect it, the person can become very overwhelmed very easily and fall back into using. So it's having some patience, some grace. Us providers even need to remember this too, and it becomes hard to do too. So this is a real thing. So ways to manage the symptoms though, the biggest thing is to be getting your basic needs met, eating well. And this is not just eating junk food, although the body craves this stuff after people stop using a lot. It's also making sure that you're eating wholesome foods. You're eating nutritious things as well as junk food. You can have junk food too, sometimes of course, but eating your grains and eating fruits and eating vegetables, having dairy if you can eat dairy, and having enough water is a huge one, drinking enough water, hydrating yourself, getting enough sleep, which I know it's contradictory because it says sleep disturbances, but if you can sleep, of course, that's the most healing thing for your body and your brain, okay? And if you are having these things and they're really disturbing your life, some people will go on medications and talk to their doctor about this stuff, and they're like short-term things to help sleep, for example, things like that. Talking to people about the symptoms can really help, to say, here's what I'm experiencing, I need you to give me some support during this time. That's great, that's a great thing to do. I need you to take this load off me while I'm dealing with this, please, and I will take it back when I'm feeling better. Setting goals, and especially ones that will say, I'm not going to feel like this forever. In the future, I'm going to feel this way. Here's my goal, and working towards them. And obviously, counseling can help you keep those goals, okay? Playing the tape all the way through is always a good thing to do. Like, just because I'm feeling this way, is using actually going to make me feel better? Or am I going to have to go through this again in a month when I want to stop using again? Okay. It warns about sugar and caffeine because those can make things harder. It can make, of course, sugar and caffeine can make you more restless, more irritable, more nervous. Of course, it will help you sleep less if you're drinking caffeine all through the day. That's something to think about. And just having balanced living in general. And there's a video on abstinence versus recovery, abstinence versus sobriety. And that video is what I'm talking about by balanced living. If you're not changing anything, you're still going to be miserable, frankly. You're going to have all the same problems and bullshit, but without the substance to cope with those things. So even when you're feeling like crap from the post-acute withdrawal, still working towards a balanced lifestyle is the ultimate goal, okay?